Hi, Joanna Hodorowska, Nutrition in Motion, Nutrition for Body, Mind, Spirit, and Sport. So a lot of you may know and some of you don't know, but I do a lot of work with the anti-inflammatory diet. And that is actually one of my specialties, anti-inflammatory diet, balancing your blood sugar, pain management, and sports nutrition, and GI issues. So most of the, actually the pain management and the GI issues are two of the primary areas where the anti-inflammatory diet is really helpful. So inflammation, it's a great thing. So when you stub your toe or, stick your finger where it's not supposed to and it hurts and it swells up, that's actually inflammation. That's normal. That's the way your body's supposed to react. The problem is when it stays inflamed and you end up with chronic inflammation. It's something where most of us don't realize that the foods that we're eating may be contributing to some of that inflammation. I had to go through my hip replacement and having that hip pain to realize that, certain foods really made my hip hurt like heck, and other foods just made it go away. And the few weeks before the surgery that I had for my hip replacement, I perfected an item that I call the JShake, the Anti-Inflammatory Elixir, and all of my pain went away. Literally, there was my joints telling me what the weather was going to be. When the temperature dropped, my hips didn't tell me. When it was going to rain, my hips didn't tell me. And it's just kind of a beautiful thing to be able to just be and do the activities that you want without having the pain. So pain is a big one, and especially joints, elbows, arthritis. That's including rheumatoid as well as osteoarthritis. And of course I had arthritis in that hip. And I went into surgery with no pain. I have helped countless of people that are having knee replacements, hip replacements, any kind of joint replacement and surgery to go into surgery with no pain. And you know what? It really helps with the recovery process because you want the energy of the body that you have to be working on healing. So if you want your doctor to say, wow, what did you do? That would be because you're on the anti-inflammatory diet. So area where the anti-inflammatory diet, it just does wonders. And you can do it with have to change everything in the diet, but there's some primary things, wheat, sugar, artificial colors, artificial sweeteners. They are pretty much right there on top of the list of the inflammatory foods. But the other symptoms or the other conditions that the anti-inflammatory diet helps with is pain and, headaches. It could be migraines. The anti-inflammatory diet works great for that as well. GI distress. Your gut's inflamed. And if your gut's inflamed, you're going to be running to the bathroom all the time or not being able to go. And there's an imbalance there. So it's about trying to take the fire out and replace with foods that you can eat that is not aggravating the situation. Because just being on an anti-inflammatory diet doesn't mean that you're just eliminating foods. You also want to include foods that are not going to be an issue. And once you are pain-free and able to feel everything working normally, your life just changes and you start feeling amazing and you can do all the activities without having to worry about, where's the next bathroom? When's the next time I'm gonna have to take an Advil or some kind of a pain pill? So if you are interested in learning more about the anti-inflammatory diet, you want to give me a call. Joanna Hodorowska, Nutrition in Motion, nutritioninmotion.net. I can provide you, at least for starters, with a chart of foods to include and foods to avoid, to at least give you a starting point of where to start implementing that plan. And I can also sit down with you to go over that to say, okay, well, which one's the most that you're including, which one is actually creating the biggest problem, and how can we work on creating that better roadmap for you so that when you are doing the anti-inflammatory diet, it is actually for you specifically and includes the foods that you can eat and includes the list of foods that you should avoid, because nobody likes to be in pain and nobody likes GI distress. So if you want a solution, the anti-inflammatory diet is it, and I can help you with that because I've done it for myself and I've done it for clients for the last 14 years. So if you are ready to be pain-free and GI stress-free,
Nutrition in Motion, Nutrition for Body, Mind, Spirit, and Sport.